Hello, we are Team 5, and our presentation is on heart disease and smoking.
All right, class. Our clinical scenario is based on a patient named Michael Jenkins. His current health issue is coronary artery disease due to smoking. Mr. Jenkins is a 35-year-old male, 6'2", and weighs 272 pounds. He works as a full-time grocery store manager. According to the BMI standards, he is overweight for his height and weight standards. He has been smoking 2 packs of cigarettes a week, along with having an unhealthy diet. He does not exercise regularly, and even walking up and down stairs is hard on his heart and lungs. A little bit about his lifestyle habits. His diet is unhealthy, so that includes fried food, fast food, and also junk food. He has been smoking 2 packs of cigarettes a week, like I said, in his social history. He does drink every other day and does not engage in physical activities such as walking, running, going to the gym. Anything that involves being out and about, he does not participate. A little bit about his family history. His mom has type 2 diabetes, and his father also passed away at the age of 53 from a heart attack. So he does have history of heart disease that runs in his family.
My part was on epidemiology of heart disease and smoking. Heart disease is one of the leading causes of death in the US and in the world, and it's only getting worse. It's killing someone about every 36 seconds in the US alone, and about 655,000 Americans die each year from this issue, and that puts it at about 1 in every 4 deaths that occur in the US. Evidence shows that smoking, blood lipids, and blood pressure are the 3 most important risk factors in reducing heart disease. And to conclude the epidemiology portion, I wanted to read a quote from the Institute of Medicine, and it says, "Taken together, the data indicate that poor diet, tobacco use, physical inactivity, excess alcohol use, and psychosocial factors are the major contributors to cardiovascular disease."
So a little bit about smoking. Cigarette smoking harms your organs, causes diseases, and reduces your overall health. This is because cigarettes, e-cigarettes, and any kind of tobacco product contains numerous of harmful chemicals, such as carbon monoxide, which is a poisonous gas that reduces the amount of oxygen being carried in the red blood cells around your body. Another effect of carbon monoxide is that it tends to increase your LDL cholesterol, which is your bad cholesterol, in the inner lining of the arteries, while it lowers your HDL cholesterol, which is your good cholesterol. Another harmful chemical is tar. Tar is a toxic chemical that leaves sticky brown residue inside your lungs, fingernails, and teeth. Nicotine is a highly addictive chemical found in cigarettes. Depending on how often you smoke, this chemical can stay in your body from 6 to 8 hours. Some effects of nicotine include increase of heart rate, increase of blood pressure, the narrowing of arteries, blood clotting, and more. The harmful effects of these chemicals are not limited to smokers. They can also affect the health of anyone around them. For example, secondhand smoke. Secondhand smoke is when someone involuntarily inhales smoke from burning tobacco products like cigarettes, cigars, hookahs, or pipes. This also includes breathing in any smoke that someone else has exhaled. So who is harmed by secondhand smoke? Basically, anyone who's exposed to it. It causes health problems in both children and adults. So a person's risk of heart disease and heart attack greatly increases the more and longer they smoke. People who smoke a pack of cigarettes a day have more than twice the risk of a heart attack than non-smokers. Smoking is a major cause of coronary artery disease, which is the most common type of heart disease. This happens because the heart's arteries can't carry oxygen and nutrients to itself because they are damaged, diseased, or blocked. This buildup of the plaque is called, or is also known as, atherosclerosis. Some symptoms that patients develop include chest pain or angina. You feel pressure or tightness in the chest, shortness of breath, heart attack. Women are more likely than men to have less typical signs and symptoms of a heart attack. So instead of neck or jaw pain, they might experience shortness of breath, fatigue, and nausea. Other than smoking, the damaging of the arteries may be caused by high blood pressure, high cholesterol, diabetes, or insulin resistance, and having a sedentary lifestyle. So some risk factors of coronary artery disease include poor diet. Eating too much food that has high amounts of saturated fat, trans fat, salt, and sugar can increase your risk of coronary artery disease. High levels of fat and cholesterol in your blood. Aging, getting older increases your risk of damaged and narrowed arteries. Family history, if a close relative developed heart disease at any early age, your risk for CAD is higher. For example, your risk is highest if your father or brother was diagnosed with heart disease before the age of 55. One last thing that is important to note is that risk factors often occur together and one may trigger another, and when grouped together, certain risk factors may make you even more likely to develop coronary artery disease. Management strategies for coronary artery disease. So some methods to manage CAD include quitting smoking. One of the best strategies a smoker diagnosed with heart disease can do to manage their health is to quit smoking. Quitting smoking will reduce your risk of sudden cardiac death, a second heart attack, and death from other chronic diseases. Medication. Some examples of types of medications for patients with CAD include anticoagulants. So these are known as blood thinners, but don't actually thin your blood. They just work to decrease the clotting ability of the blood. Aspirin, what they do is that they keep blood clots from forming. Nitroglycerin, which is the most common vasodilator used for acute cases of angina. So what it does is that it dilates or widens the coronary arteries, and it can increase the blood flow to the heart muscle. Other strategies include eating a healthy, balanced diet, stress management, knowing the symptoms of a heart attack and stroke, and increase of physical activity.
Alrighty, some of our resources we used was the CDC. We pulled a lot of information from them. We also used the Mayo Clinic, Medline Plus, the American Heart Association, and the USDA, which is the U.S. Food and Drug Administration. I will go ahead and go over what these resources, what information these resources gave us and how it was useful. So from the CDC had a section on the website that was dedicated to everything heart disease related. We did pull some stuff from the Mayo Clinic. Of course, it's a very world-renowned hospital and clinical site. They also had a lot of information dedicated to the patients on the disease, symptoms, treatments, and even doctors within their facilities that you can visit and see if you're having an issue with coronary artery disease. The American Heart Association was a perfect resource for everything heart related. We did the USDA. They had a section dedicated on tobacco products. They also made sure to highlight how smoking affects the heart of somebody who is an active smoker. They also mentioned on their site how they plan on lowering nicotine levels in cigarettes to decrease the addictive behavior that one develops when they're smoking.
These are the references utilized to develop the plan. The theories involved are social cognitive theory and trans-theoretical model. Trans-theoretical model in detail includes pre-contemplation. Ignorance is bliss, simply put. Contemplation is when one's sitting on the fence. Preparation is the making the change, planning, and then the action is the application of the changes, practicing those changes, and then the maintenance is the continued commitment to those changes. This is the general overview of Michael's plan. It starts off with thinking, knowing the reasons for quitting and making the changes, knowing the risks and looking forward to the rewards, ultimately leading up to deciding, is he ready to quit? Following that is the preparation. Setting one's mindset is important as this is a commitment. Setting goals, reviewing past attempts if he has made attempts before, looking back as to why and how it may not have succeeded in the past and what could have been done better, getting the support, and then learning new skills and behaviors. Next to that is the action, smoking cessation, action in everyday changes. For CAD, there's usually medications to take that includes ACE inhibitors, beta blockers, and depending on the severity of one's CAD, sometimes blood thinners. And then there's the support, counseling and whatnot. And then next to that is the maintenance, the abstinence, maintaining the healthy lifestyle, once again, taking those medications and reaching out to those support. Challenges that one may stumble upon are triggers, the stress and mood, withdrawals. Nicotine is a big one. There's also junk food and unhealthy habits, and cannot take away the possibility of slips and relapse. So a way to stay on track is encouragement, self-exploration, evaluation of the pros and cons, reminding yourself the purpose of your why, and looking at the small wins and taking those small steps. Um, Staying patient and forgiving with oneself, definitely self-love, support as well. And believe a big one that will help are the tools. That may be medicine, like nicotine replacements, such as patches and gums. Another one is Chantix. There are programs out there that one can utilize. There are state programs that one can reach out to. Practice Quit and Smoke Free Text and Daily Challenges. So these three text messaging programs, Practice Quit is 1 to 5 days, and basically you receive daily text messages for support in quitting. And in Smoke Free, it's 6 to 8 weeks. And Daily Challenges is a bit different. It helps build skills for becoming smoke free. There are apps out there as well. One that caught my eye was Quit Guide app. And this is basically an all-in-one app. It helps understand smoking patterns, build skills needed to become and to stay smoke-free.
So for the slide exercise, in the study high-intensity interval training in patients with coronary heart disease, prescriptions, models, and perspectives explains that maximum aerobic power VO2 is a predictor of mortality and morbidity in coronary heart disease, CHD patients, making exercise programs the component of continuous aerobic exercise training, CAET, to be safe and to improve prognosis in CHD patients. Furthermore, in the study, high-intensity interval training HIT showed greater or equivalent benefits as compared with CAET, and the use of HIT does not seem to decrease exercise compliance or increase cardiovascular events when properly prescribed, and is well tolerated and appreciated by the patients. According to the U.S. Department of Health and Human Services, suggests that adults maintain at least 50 to 75 minutes of vigorous activity or a minimum of 150 minutes of moderate intensity cardio per week. So for diet, here's a couple of ways to switch to clean eating, as well as a shopping list. Stress management, according to the Mayo Clinic, here are some of the ways to reduce stress. The plan of action, a gradual transition to incorporating these new lifestyle changes is key not to overwhelm the patient. We will begin by simply having the patient write down monthly goals that they would like to achieve relevant to their lifestyle, such as cutting down on fast food, walking 1 mile every other day, reduce smoking, stress management, etc. Allow the goals to have importance to the patient. The next step would be creating a detailed plan for exercise, diet, and stress management. Patient will have a monthly plan to follow that progresses patient to using healthy habits up to 3 months. Patient will reflect at the end of the month on their progress, as well as the administrator. Month 1 would look like exercise, walking, or any moderate activity for at least 150 minutes per week. Diet, creating awareness, limiting fast food and refined carbs, making a grocery list with the patient that has many healthy options. Stress management, having the patient choose one way that they would like to focus on to alleviate their stress.
That concludes our presentation on heart disease and smoking. These are our references. Thank you.